Well, greetings everybody, and as part of our series introducing key friends and colleagues, I'm very proud and privileged to introduce Dr John Cummins to you today. John is my own physician, and one of the things you learn very quickly in life is to make sure you're surrounded by good people who can take care of you when you most need it. So welcome, John, and thanks for joining us today. John, perhaps you could just explain a little bit about the value of annual checkups and what you seek to achieve by doing that.
I think, well, there's probably, in my view, and I'm biased being a doctor, but probably nothing more important than life, because at the end of the day I think relationships, financial security, things like that are critical, but if you haven't got your health then you haven't really got anything. I'm like most doctors, I'm very well trained in illness medicine, but what really inspired me probably 20-25 years ago was the power of prevention. And I say to people that come to us that basically I can probably stop, or we can probably stop about 80% of causes of premature death before the age of 85. So what I say to new people is to say, look, you've got, broadly speaking, you've got heart disease and plumbing problems, of which 90% is lifestyle related, and you've got cancers. And if you think logically of the cancers, you're looking at lung cancer as the commonest cancer killer, which is about smoking. You've got bowel cancers, number 2, which you can prevent with a colonoscopy. Number 3 is prostate cancer, which you can pick up early. Number 4 is breast cancer, which you can check with a mammogram and or ultrasound. Lymphomas and melanomas 5 and 6, which you can check with a physical examination. So I'd say to people, look, your health is really your greatest asset. We can get you to 85 in great shape, with probably 80-90% probability. Your job is basically to show up for an annual health check, and our job is to look for signs of early problems and make sure that you're doing those right things that's going to ensure that you get to that age without any chronic illness. And the evidence is there, it's very clear, critically important. Businessmen get it, they really get it, so that we see that they follow success principles in life. Part of it's prioritising goal setting, and they will come in typically once a year and have their annual top-to-toe checkup, and they follow advice as we give it to them.
Well, thanks, John. I know that I feel an awful lot better having gone through that process personally.
It's reassuring, isn't it?
It is. It can be a little confronting the first time, but once you've gone through that process, let me say this: I don't think ignorance is bliss with medicine. I think whatever position you're in, get in front of a good, qualified doctor. Even if it's bad news, the sooner you know about it, the better. And having been to far too many funerals, far too many cancer and trauma claims over the last few years, prevention is much better than the cure. So, final question, John. For those who don't have a regular physician at the moment or are keen on an annual checkup, how would they go about doing that review?
Oh, look, I think we're easy to find. If you just search for executive medicine on the web page, that's very easy to find us. If you search for Dr John Cummins on the internet, you could call us 92903259. I think we do it probably as well as anyone in Australia, but if you've got a really good doctor, that's great. But at the end of the day, you just want to make sure that you've got someone that's got an interest and an expertise in prevention as well as managing a chronic illness should it occur, basically.
That's great, John. Well, thanks for joining us today.
Thanks, Tony. Yeah, pleasure.